Posterior total hip replacement. This exercise video is focused on teaching you your dislocation precautions so you can avoid positions and activities that may possibly dislocate your new hip. Typically, after a posterior total hip replacement, you'll have precautions for dislocation, guarding against flexing or bending at the hip past 90 degrees, crossing the leg cross midline, or internally rotating the leg. The first hip precaution is hip flexion or bending past 90 degrees. You'll want to avoid bending the hip past 90 degrees to avoid possible dislocation. While sitting in a chair, avoid bending in the hip past 90 degrees. 90 degrees is this position, straight up and down. Avoid leaning forward, going past 90 degrees. Or another example of that position in standing is to do a full squat, picking something up off the floor, knee to chest. To avoid the dislocation precaution, get your foot out to the side, bending at the hip without bending past 90 degrees. It can be easy to flex too far forward, getting up out of a recliner, or sitting down into a recliner if you're not careful, as in this example. Instead, keep the leg well out in front of you and use the strength in your non-surgical leg and your arms to lower yourself into position without bending the hip past 90 degrees. You can use the strength in your arms to slide yourself back in the chair once you've kicked your legs up into position so as to get comfortable. Crossing midline. Another hip precaution is avoiding letting the leg cross your midline. Your midline is an imaginary line splitting the left and right side of your body. This would be an example of crossing the leg across midline while laying down. Avoid crossing your legs. This is an example of crossing the leg over midline and sitting. Hip internal rotation, or pointing the toes inward. Another precaution is allowing the toes to point inward or inwardly rotating the leg. A typical example of this is standing on the surgical leg, the left leg in this example, and turning towards that leg to walk. Your weight is on the surgical leg, and as you turn towards that side, it rotates your toes on the surgical leg inward or internally rotates your leg. This would be an example of standing on the surgical leg, the left leg in this example, and turning towards that side, resulting in the toes pointing inward. Instead, stand on the non-surgical leg and pivot to turn to walk, avoiding rotating the surgical leg. Thank you for your time. Abiding by these precautions will help decrease any chance of dislocation and/or possible tendonitis or aggravation of the incision on your new total hip. We wish you well in your recovery.